Hi, everyone. Good morning, Dan, both to folks here in the room and those of you online. And I want to welcome all of you to the third GroundsWell Early Career Research webinar. My name is Luis Schwarz, and I am part of the GroundsWell team at the University of Edinburgh. Just to give a little bit of context, GroundsWell is a 5 years project across Belfast, Liverpool, and Edinburgh, aiming to ensure that urban green and blue space benefit everyone, especially those who need them the most. Regarding this webinar series, it was designed to showcase the work of early career research and highlight the valuable contribution of our partners and who help us to build strong links with the community across these 3 cities, again, Belfast, Liverpool, and Edinburgh. Okay, before we begin the webinar, even though we are just a few of us here in the room, just a quick note of housekeeping to let you know that we do not expect a fire alarm today. However, if you want the sound, please just leave immediately the room towards the main door and as far as possible towards the pavement, but there should be a fire marshal giving more instructions if that happens. Okay. Returning to the webinar today, we will have 2 great presentations in a topic that is real, particular to me, because I like to engage with the grassroots movement and try to define strategies to work with them and to empower them to become kind of co-designers with me. So this is particularly relevant to me and to my work and many of us today here. So we will have 2 presentations today. The first one is by my colleague, Charlotte Wendelboe-Nelson, which title is From Barriers to Bridge, Community Researchers as a Methodological Innovation in Health Intervention Evaluation with Structurally Disadvantaged Communities. And the second one will be delivered by Anissa Tabet Mamar, she is a senior community researcher at Edwell States, one of our partners with a very interesting project with us, which sits in one of our innovation funds grants. The title of this presentation is Integrating New Scots into Local Community Through Community Growing Projects, Overcome Barriers Through Trust and Lived Experience. So the 2 of them very well. And so each presentation will take approximately 20 minutes, so total 40 minutes. We want to leave a few time for the hand to engage in question and answers and the discussion. I think that is a rich part of any webinar. So this said, and without further delay, I will now hand over to Charlotte. The stage is yours.
Thank you. So I was going to say something about GroundsWell, but now you've sort of said it already. So I'll skip that bit. So the work that I'm presenting today is focusing on structurally disadvantaged communities, specifically how to engage them better. As Louis was mentioning, these are the populations that would perhaps benefit the most from access to green space, but are probably also the communities that are the most likely not to benefit from them because they're not using them. So the research, sort of the starting point of it, was some of the observations that we did initially when we started working with these communities. So we were working with some small-ish community organizations with communities that are often described as hard to reach or difficult to engage. And through working with these organizations, we started thinking about different, perhaps better ways in which we could engage these communities. And maybe at least part of the problem might be, if not solved, then improved by trying to use a new pathway to engagement. And just to make sure that everybody knows what I mean when I say community researcher, the definition that we are using is that it's a member of the community that's being studied who is trained to collect evaluation data They possess lived experience of the challenges and interventions being evaluated, along with established trust relationships, cultural competence, and insider knowledge, and enables them to gather authentic data where appropriate. They can also support in the evaluation of the data. So I'll start by showing a video that we produced sort of at the beginning of this project that will set out the sort of initial findings and what the work that the rest of the presentation will focus on, what that work is building on.
Community researchers and co-production, identifying new pathways to impact generation. Researchers at University of Edinburgh are looking at ways to help alleviate health inequality. We know that visiting green and blue spaces can help improve mental health and well-being. Nature-based health interventions, such as outdoor activities provided by community organizations, have been successfully used to engage people in the use of outdoor spaces. Nature activities in local communities are becoming more popular as a cost-effective alternative to medication when treating non-communicable diseases, also called NCDs, and poor mental health, and in preventing poor health in the first place. Such activities have shown to be particularly beneficial in structurally disadvantaged communities, where we know the access to outdoor spaces is often poor, and there is a greater overall risk of developing a range of NCDs. In addition, these communities are difficult to engage in community activities and health interventions in general. This has resulted in health inequalities in our society, which means that life expectancy increases as deprivation decreases. The difference in healthy life expectancy between the most and least deprived areas is almost 25 years for females and 26 years for males. So what can we do to change this? We are currently investigating new pathways to engagement and impact generation. Preliminary work indicates that focusing on small-scale changes in local communities can help prevent poor mental health and well-being and encourage healthy lifestyle changes, which in turn can delay or even prevent the development of some NCDs. Engaging communities in nature-based health interventions, as a starting point, is a more cost-effective way of reducing health inequality over time than to treat NCDs once they have developed. The question now is, how do we engage structurally disadvantaged communities? Our research shows that involving people from the local community, also known as community researchers, in a co-production process, can improve engagement and help create lasting impact. Our findings show that this pathway is successful, due to the community researchers' lived experience, pre-existing rapport with the local community, and because the community researcher acts as a link between the community and the academic researchers. We found that co-developing engagement and evaluation processes with community researchers can improve engagement by creating a more trusting environment, which will encourage participants to share more meaningful experiences. It causes less disruption to the activities than the presence of academic researchers unknown to the community. This, in turn, leads to a more robust monitoring and evaluation process. And finally, the knowledge and skills stay in the community when the academic researchers move on. Using community researchers can provide a new pathway to engagement of structurally disadvantaged communities and improve translation of research and impact generation, thus help alleviate health inequality.
I'll just stop the music. So this was sort of the starting point that came before the projects that I'm going to talk about today. So we saw the reality of many of these structurally disadvantaged communities, and they face barriers to formal systems, not because they are difficult, but because of structural factors. So past negative experiences with institutions and different communication styles and preferences, and multiple intersecting disadvantages. And this creates barriers. And when we try to collect evaluation data, we face cultural and linguistic barriers that affect data authenticity. So we might struggle to access certain populations, and building trust, as you know, takes time, often more time than typical research projects allow. or longer than activities or interventions that are provided by the community organizations last. So the time to build these trusting relationships is not always there. So this has led to a gap in documenting the impact, so how it's documented. And the organizations struggle to demonstrate their effectiveness, so they can build they can't build a complete picture of the community outcomes, and this can affect their ability to secure funding. And even when they are delivering valuable service, it can be difficult for them to prove it or to show the impact that they're delivering. And more importantly, it's difficult to find out what works for whom and in what context. So we asked the question, could community researchers help bridge this gap? So you see, the academic researchers bring validated tools, scientific methods, research design expertise, data analysis skills, and these are essential for producing credible evidence. The community expertise that the community brings is the lived experience, the cultural competence, established trust, local knowledge, and they're equally essential for authentic engagement. So the question became, how can we bring these two types of expertise together, not by replacing one with the other, but by creating a genuine partnership. And this collaborative model offers several methods, advantages. The community researchers can provide enhanced access to populations that external researchers can find difficult to reach. They offer cultural interpretation that goes beyond translation to understand how well-being concepts are expressed in different communities. They enable trust and authenticity because participants feel more comfortable with someone from their own community, and they bring nuanced understanding of community dynamics. But importantly, community researchers don't replace external evaluation, they complement it. So we're combining academic rigor with community cultural expertise. And the goal is evaluation approaches that are both scientifically valid and culturally authentic, led by academic researchers working in genuine partnership with community members. So this led us to the central research question. What training, support and skill development process are necessary for community researchers to collect consistent, reliable data? And this question recognizes a dual requirement. On one side, we need academic standards, the rigorous methods, validated tools, consistent data collection, and validity. And on the other side, we need authentic community representation, cultural competence, lived experience, and trust relationships, and the sort of contextual understanding. So the critical balance is that the community researchers must be equipped to maintain scientific rigor while preserving cultural authenticity. And the evaluation data needs to be both scientifically sound and genuinely representative of the community's experiences. So to answer those questions, we conducted a systematic comparison of community researcher approaches across three diverse organizational contexts. With the welcoming, we work with immigrants, refugees, and asylum seekers participating in outdoor health interventions. And with the charity Midnight and Beyond, we studied young male offenders involved in outdoor activities. And with Edible Estates, we examined social housing residents and new Scots engaged in community gardening and climate adaptation planning. So these diverse contexts allowed us to understand what's universal about community research approaches and what needs to be adapted for specific populations. So the methods we used, we combined two approaches. We conducted implementation assessments, documenting how things actually work in practice and monitoring the engagement and completion rates. And we examined how evaluation integrated with service delivery and identified barriers and adaptations needed. We also conducted stakeholder interviews with community researchers, project managers, and activity participants, and we analyzed these using reflexive thematic analysis. And I think very important, the research was co-produced with community organizations, and they weren't just sites for data collection. They were partners in designing the study and interpreting findings and developing recommendations. So the key findings, our first major finding relates to how community researchers enhance data authenticity. So we found that through cultural competence, they navigate linguistic nuances that go beyond simple translation. So, for example, they interpret how well-being concepts are expressed across cultures and communities, and they can recognize response patterns, and they adapt tools to different cultural contexts. And through the established trust that they already have, pre-existing relationships enable them more honest feedback. They reduce what we call social desirability effect, which is a tendency to give answers that sound good rather than honest answers. And they provide access to populations that are genuinely hard to reach through other means or can be hard to reach. And they minimize the disruption to the natural interaction that happens in the organization. And the second key finding is the implementation requirements that vary significantly by context. So I think when I started doing this, I had this idea that one type of community researcher would fit all community organizations, and it has become very clear that that's not the case, that it has to be adapted to different organizations and different contexts. So with immigrants and refugees, we found the need for high intensity support, extensive cultural interpretation, multilingual capability, and translation of abstract concepts. And the focus for these projects were on cultural and linguistic competence. And with young male offenders, we needed a more flexible approach, a peer-led model using participants' preferred communication platforms, like Snapchat. So literally any other communication failed, but Snapchat was the platform that worked for them. So the focus there was on relationship management and flexible scheduling and that accommodates chaotic lifestyles. And for some social housing, Edible Estates implemented a distributed model with multiple community researchers across different locations. And the focus there was on coordination and maintaining consistency across sites. And for the New Scotch project with Edible Estate, that Anissa will talk about shortly, we used a senior community researcher, which is Anissa, to connect recent immigrants with community gardening while supporting junior community researchers across multiple sites. And Anissa has functioned as both a cultural interpreter and data collector. So I think one of the most critical findings from working with community organizations was about the sustainability of it. So they told us clearly that evaluation cannot be an additional burden. So what they told us worked was adding or that more work is not added to the staff, but creating separate evaluation activities should not be done, and causing external disruption to services and making unsustainable resource demands. But what did work was embedding evaluation within service delivery, integrating it into daily operations, and making it a natural part of the existing processes, creating a sustainable and scalable model. So the key principle is that the evaluation must be woven into existing service delivery models and not imposed as an additional burden on already limited resources. And based on that sort of evaluation, the thematic analysis that we did, we developed a 5-phase implementation model. So phase 1 should focus on foundation and partnership development, phase 2 on capacity building and training, and phase 3 on culturally responsive implementation, and phase 4 on collaborative analysis and interpretation, and phase 5 is on sustainability and knowledge transfer. And then running through all these phases are 6 cross-cutting principles: cultural competency, trust and relationship maintenance, and community ownership, policy assurance and power sharing, and structural awareness. So based on this sort of evaluation of these 3 projects, there's a publication that's almost ready to be submitted. So the sort of summary of all this and the implementation model will be published shortly. And then for each of the projects that has been involved in this sort of overarching project, a more sort of traditional evaluation will also be published, where the findings that Anissa is going to tell you about will be included. And that's it.
Okay, thank you so much for your talk, very interesting talk. I encourage all of the participants in this webinar to save the questions to the hand, so we will put all of the questions to both Charlotte and Anissa by the hand of it. And without further ado, I will let Anissa now present.
Should I just unplug and... I think it should work now. Oh, there you go. Okay, sorry, I will be. I'm sorry if I. Okay, hi everybody. Good morning. Thanks for having me here today. My name is Anissa Tabet. I'm the senior community researcher at Edible States, and today I'll be introducing our project on integrating New Scots into local communities through community growing projects, which is research that is funded by the Innovation Fund project through from GroundsWell through the University of Edinburgh and delivered by Edible States. So the presentation objectives would be, first of all, to introduce the study, what we did, why we wanted to work with New Scots, what we meant by New Scots. I'd also introduce the methodology and how we worked with lived experience and how we introduced community researchers in the process. And then some preliminary findings. We haven't done the evaluation yet of the study. We're finishing with the field work. So some of the themes that have been coming along throughout these months since the project started at the end of April this year. So before I start with the research, just a very brief introduction about Edible States and also very briefly about myself. So Edible States is a community interest company that since 2017 has been working with other third sector organizations that operate in council estates across Edinburgh to develop community gardens and green spaces. Alongside that, we've done lots of work with primary school children, with school farms, and with young people in high school with different, the project is called Growing Youth, so getting them involved with the gardens and teaching them new skills such as building sheds and other structures around the gardens. With always operating in council estates across Edinburgh, and kind of the aspiration is to move from Edinburgh to other places in Scotland. With regards to myself, most of my work has been focused on migration, human mobility. I've done lots of work with migrants and refugees doing advocacy work, frontline advocacy work. I've also worked with unaccompanied refugee children and people in detention facing deportation. I worked more recently with Oxfam as a human mobility coordinator for North Africa in 3 countries, Morocco, Tunisia, and Egypt, kind of countries of origin of migration, but also transit. So countries where migrants from different parts of Africa transit in their journeys to Europe, and kind of that also gave me that understanding of reading into migration, migrant experience through the lenses of inequalities, and kind of identifying those systemic and structural barriers. So that's the introduction. With regards to the study of new Scots, being edible states placed in this council states for many years, and there is a high percentage of people who are migrants, who are new Scots living in these communities, and a lot of them joined community gardens. So we thought this study would give us an opportunity to kind of try to understand if community gardens, who we know are good for your well-being, for your health, for connecting you to nature, for increasing social cohesion and so on, could be also places that include people from abroad, could be places where if you don't know anyone in your area and you've just moved, you can meet someone, you can build community, you can have that closeness to your neighbors and kind of have that connectiveness to your local area. We chose the term New Scots, acknowledging that it's not a perfect term, that is not representative of everybody's experiences, but we thought it was a more inclusive way to refer to people, and kind of has less negative connotations than migrants, how it's being used and instrumentalized. So we use the term New Scots to refer to people in this specific study who came from abroad and made their homes in Scotland in the last 10, 12 years. It doesn't mean that we didn't interview anybody who stayed here for 20 years or 15 years, but that mostly our focus was people who've been here in the last 10 years or less. And with regards to also why this specific group of people, we did it for 2 main reasons, and we prioritize working with this group for 2 main reasons. The number 1 reason is when we talk about poverty and disadvantage in the communities, migrants are overrepresented. Migrants today in Scotland represent the 10.2% of the population, as opposed to the 3.8% that they used to represent in 2004. Despite this, migrants are significantly poorer. 44% from ethnic minority groups. 70% of those are born outside. So we're mostly talking about New Scots, and migrants are poor, as opposed to 18% of the local white population. When it comes to children in migrant households, it's 48% of children living in poverty in migrant households. Migrants are hit harder by unemployment. They earn less, they work more, and they are more at risk of exploitation. So because of that, we prioritize working with this group. And on the second big element was a recent report that was released, I think in July, by British Future and the Belonging Network, basically saying there is a worrying decline in community cohesion in the UK, that the ties that used to hold society and communities together are disappearing by the lack of community infrastructure and the deterioration of public services and lack of civic participation. And if we mix that with political distrust towards the politicians, and if we mix that with cost of living crisis and housing crisis, and if we mix that with a campaign that lasted for years to dehumanize and criminalize migrants, then we create the perfect conditions for anti-migrant sentiments and division and divisiveness and hostilities within our community. So kind of our initial hypothesis was, if people get together, if people get to share a space together in an equal to equal basis, if people get to recognize each other from a human to human perspective, then there is a possibility that we create little small barriers, small hubs of solidarity, of community cohesion, of anti-racism in these communities. So how we did it, we started by two very simple guiding questions. The first one was whether and how community gardens have helped New Scots overcome social isolation and contributed to increasing their sense of belonging, community, and ownership within their communities. And the second was around exploring the barriers that people might face when joining these spaces. Safety, feelings of not being very safe in open spaces, lack of confidence, language barriers, childcare, difficult work schedules, wherever, what was it, is what we wanted to look at. So we selected 5 gardens run by edible states located in different council states across Edinburgh. 5 very different areas. So one was Muir House, there were 2, one was the Calders, another one was in Western Hills, Danby Dykes and Hutchison. So a variety of gardens in terms of the number of people that go to the gardens, the number of New Scots that are engaged in these gardens, the number of ownership. Some of these gardens are pretty much community run. Others do require still a lot of support from edible states. And kind of in some of these gardens, there is a big majority of New Scots, in others not so much. So kind of try to present that variety of experiences and engagement, and also kind of different geographical locations. To do this work, we started a round of contacts with community gardeners to help us promote the study and access both participants and community researchers. And kind of the idea from the beginning was to engage the community as much as possible in this dialogue of how we could make these spaces more accessible and welcoming for people, for everyone, but in particular for people who are new to the area, for people who struggle with language and social isolation and so on. And eventually we did engage 2 community researchers that were key in this process, that are still key in this process, and I will talk about more later. In terms of the data collection, is qualitative through different ways of interviewing people, and trying to adapt that really to what people wanted. We did lots of walk-in interviews. We did different informal chats in the gardens with groups of women. We've had chat with people while they were gardening. We've had chats in people's in their homes, in the library. So very, very open and kind of, adaptive. In terms of some of the initial challenges, and Charlotte has mentioned a few of them already, which they apply to this study. So initially there was a certain reluctance from participants to engage. Not everybody was comfortable with kind of being singled out within their communities as New Scots, as the other, as migrants. And that was also the case for community gardeners. She worked really hard to make these spaces available and welcoming and accessible, and kind of spaces where you don't need to justify where you're from and who you are, you just join along. And there was a certain discomfort from my colleagues, the community gardeners, who kind of have to ask people where they were from, or assume that people were from another country just based on how they looked. So because they didn't have these conversations with people before, and to kind of mitigate that, it was key to getting on board the community researchers. There was also a level of distrust, which I think is common, and that as well in these communities, not just because there is a big level of stigma when we work in these communities, and communities are very much aware of and suffer because of the stigma, but also a certain, I felt sometimes that if we're not careful, we can do a certain exoticism of poverty, of treating that as something exotic that is worth kind of studying in not in a very careful way, and people notice that as well. And then there is another level of distrust, which is another theme, and one of my colleagues always tells me, one of the community gardeners, that she spends most of her time trying to convince people that it's worth it, that they should try things, that is fine to do new things, because they often, not always, and not for everybody, but there is this thing of what's the point, what we need to know, this is not going to improve, this place is horrible, it will always be. So yeah, I don't really feel like engaging, and that was there as well in the beginning. And finally, my own limitations as a community researcher, which are really as well, important to mention. I am a migrant, so I can relate, and I can relate to certain points to these groups, but there was a class kind of element that separated me from these communities. I've never lived in a council state. I don't know the codes in council states, and that was a learning process for me. And that's why, again, community researchers were key to help me understand and kind of not just the community researchers, but like the different interactions, and in a way, immersing myself in the community has helped me to understand that it's complex and that you need to be really inside to understand that, because things are not the way they kind of might appear in the surface. So in terms of methods and the work we did with community research, the work we did with community researchers, again, part of these challenges that I was talking about were overcome by community researchers. For this specific project, we hired two very different, and kind of their expertises were complementing. And please keep me right with the time. Yeah. One was from Canada, so kind of global north, unless she speaks, you could think that she was Scottish, and melted really well with the local population, and had this lived in your house for many years, and now and she has a great understanding of the community, but also she has this way of looking at things from the sociological, political way that was really helpful for this study. The other one is a woman from Bangladesh who has excellent interpersonal skills, amazing access to the community. She was able to interview people from the Bangladeshi community, but also from other nationalities. And she was really good at encouraging people to go to community gardens and kind of spread the word, both of them, to spread the word about how we wanted to make these spaces welcoming, and how we were particularly interested to work with New Scots. And that was generally a very positive experience, and as well to translate the study to the community and reach people that without them I wouldn't have been able to reach. And there's also like a time limitation of the study. So in terms of more broadly, I think community researchers were key in promoting these conversations around inclusion in the community gardens. People felt more comfortable with them than probably, someone outside the community to talk about feelings of not feeling very safe, or feeling targeted, or feeling or experiencing racism, and in some of these communities, thanks to them, we were able to reach a big group of women as well, which is great. And it's a group that remains sometimes very silent and very invisible from research as well. And in terms of the benefits, I think for them too, and they say to me often, it was a big deal to be part of this, because it kind of, we gave value to what they had to say, how they saw things, because we trusted their judgment, because it puts them in a position where they feel they're serving their communities, and they're doing something positive. And also it meant that they could earn a living, which is not a minor thing. One of them is a stay-at-home mom, so that meant that they could get involved with work in their communities that they really enjoyed. The numbers of new Scots joining gardens increased throughout the summer, thanks to the work of the community gardeners, which is a really positive outcome, and more people felt encouraged and kind of enthusiastic about joining these spaces. And in terms of more overall learnings, I think in my very limited experience with this project, in a way, including lived experience in research, it involves certain level of giving up control. It involves certain level that you need to admit that it might be chaotic sometimes, that community researchers might not interview the same way you do, or might not present the study the same way you do. They do it their way, and it's not a linear process. And sometimes you start the conversation and you really want to focus on something, and the conversation takes you elsewhere. But it's still, for us from Edible States, it was really important that this was a conversation that helped the community, and therefore it was ultimately up to them to kind of take the lead and talk about the things that they care about. Yeah, so some of the preliminary fundings, and I try to be relatively quick, because I think I have 5 more minutes. Is that okay? Yeah,
it should be okay.
It should be okay. Okay. So first of all, conflict is present across gardens. Gardens aren't islands. They happen within a context, like generally in areas where life is difficult, and people bring in their struggles and their personalities and into the gardens, and sometimes, especially in the last years, where some of the gardens have went from 4 people to 20. And people from different nationalities and cultures and different ways of understanding gardening and all that creates tensions. And that's not a bad thing. It's just something that we need to acknowledge. We need more, I felt like we need more tools and systems to deal with conflict. This is it is a relatively new thing. We're working with groups that we've never worked before, and we need to be more equipped with systems, with tools to be able to tackle these. And we're doing that. And finally, I think, there is a certain lack of confidence of working with migrants, not because we need to be very special about working with migrants. That's not the point. But there is a little bit of an understanding of, some of the barriers. Like for someone from the local area, maybe it's just a mental barrier of like joining the garden, or trusting that this is worth it for I don't know, for someone in certain communities is a lot more than that. Is being outside on your own, in an open space, sharing the space with other men. It involves you being in a space talking to people that you might not understand very well. all that, no? And I think sometimes we need to, there's a lot, we still have a lot to learn from this, and this is relatively new for us in some ways. Finally, it is true, and it's something that comes across, that community gardens and our community gardens are inclusive and easy to access. There is very little, I mean, once you overcome those barriers that are important, but once you decide and get yourself the courage to get in, it's a really lovely atmosphere where you can get in, you get a bed pretty much immediately, and it's very straightforward. There is a lot of peer-to-peer learning and knowledge, and this is something amazing. People from New Scots or migrants are in one of the few spaces where what they know and they bring in with their culture is not only praised but welcomed and really encouraged, and there is a lot of that exchange, and also the community gardeners who are key in a lot of this process, but that are not as many hours as you know, as probably needed. They don't work as many hours, so a lot of this work happens between people in the garden. Yeah, so a lot of this is just like really peer-to-peer without the intervention of edible states, which is really nice. And then community gardens do provide an opportunity for people to meet and work together. Sometimes in some areas, basically they only are one of the very few places where people from completely two different worlds, despite that they live in the same community, meet and do stuff together. And that's beautiful to see, and it's very powerful. And eventually, just coming back to our initial hypothesis, maybe in a very, even if in a very micro level, but we do see a lot of solidarity. We do see a lot of acts of resilience and anti-racism practice in these spaces, which is very powerful. And finally, my the benefits to the community, I say we introduce these conversations of inclusion in the communities. We introduce the conversation in an open way about racism and how we deal and how we work together, and how we work together from our differences as people. I said it before, the increase in the number of New Scots involved in community gardens. It's also been a really nice summer, so a lot of people felt encouraged to enjoy and join these spaces. We did some facilitation of conflict resolution, very low key, because the idea is to really work with the community and help the community to work this out, but we facilitated some of these sessions. And I think finally improve the understanding of how we should be working, or kind of provide a bit more of understanding to edible states about working with New Scots. So that's me. Thank you.
Okay, we have then reached the end of this presentation, the two presentations, and I would like to encourage everyone, not only in the room, but also online, to pose their questions. Please verbalize the question, don't use the chat, because I think it will be richer if we can interact using the voice channel to do so. And I will open the floor. I have also two questions, but those are not the priority. I will leave those by the hand. So there is already one person in the room wanted to ask, and then I will go online to Marit, and I will keep going in between the room and online. So.
Hi, really super. Hello. I think they can see me from the room, but yeah, it's great to listen to the two talks, and I do feel really like there's a lot of like relevance in terms of like the stuff I do as well with engagement with communities. So it's okay. So I actually have like 2 questions for both, but I know if you can choose, but I have 1 question specifically for the first talk. So for both of speakers, so I want to ask, the first is, has there been any sort of like values that emerged through engaging with community that you find really valuable? Because like in terms of like, collaboration and also care, and also like after you finish the community engagement, how to kind of like maintain this relationship. So I want to know like what kind of like values do you see is quite important in terms of like working with them, and also what kind of values do you get out from like engaging and working with them. And the second question is, how do you approach to explain from an institutional research perspective going in, how do you approach explaining the consent form and also participant information sheet to those who may have some difficulties in terms of like language barrier, etc.? Like how would you proceed? Because normally we just have a sheet and give out people sign, but I think working with communities, that's I'm suspecting that might not be the case. So that's my second question. And the third one, sorry,
Because I can't now remember the first question. So
Okay.
take them one at a time.
Okay. Cool.
And I can answer the one with ethics.
Okay.
Because because I as the academic researcher has to apply for ethics through the university.
Mhm.
I do the normal ethics process, and then I make adapted participant information sheets that are suitable for the different communities that I work with. And some of them are more pictures and a few words. So there's a lot less text on them.
Mhm.
And if it is in the communities where language is an issue, then we make sure that there's someone that can interpret and explain the content. So before they sign the consent form, that we are absolutely sure that they've understood what they're saying yes to. So it is a different and more lengthy process, I think, than what you normally would. But I think that would be there, irrespective of whether we work with community researchers or not. Because we have to make sure that the information is passed on appropriately and people know what they're saying yes to.
Okay, thank you.
Okay, Anissa, I don't know if you would like also to cover some of these questions.
Yeah, I think more question too, because I agree with Charlotte with one. Just keep me right if I get it wrong. So kind of the values we learn from working with communities, and then you mentioned something about after the research.
Yeah. Like
So the values after the research.
going in, and also at basically any stage, like is there any some sort of like values that you find kind of emerge and is quite essential to work to take into consideration when working and collaborating with different communities, like especially vulnerable communities and marginalized communities?
I mean, it's a tricky question. I spoke more broadly, and maybe we can values I've seen in the community. Yeah, I see a lot of compassion. I see lots of teamwork. I see lots of empathy. I see a really strong will to make it work, and make these places better, and put effort into the garden and take pride. I see a lot of pride as well. With the specific work with community researchers, I think the main thing is that visibility of lived experience and local expertise of people who maybe haven't studied and don't have a master's or don't have university student, but that we recognize that as valuable. I think that was pretty strong in both cases. And in terms of looking forward, I mean, one of the ideas the main idea of doing this work with the communities, that part of the knowledge stays there, so they don't need you anymore eventually, because the community has its own skills and has the knowledge to be able to do their own research. I don't know if to that level, but like part of what we learn together, or what we learn together through this specific project stays there. So it's they're not so dependent on you continuing. So yeah, I don't know if that answers your question.
Yeah, thank you.
Okay, so we will move online now. Have some merit as a question to ask, please.
Hi, Anissa. That was really interesting and so good to hear about your whole team of community researchers. I was wondering, and it's related to what you started to answer in response to the last questions. What do you feel the skills are that the community researchers have developed, and also did it impact on their confidence? If you can tell me a little bit about that, and maybe some training you did with them beforehand, that would be really interesting. Thank you.
Okay, in terms of training, not so much. The project is 6 months. I work 2 days, so it had to be kind of fast track. We did have sessions together, sessions together. Yeah, maybe we can call them training. But trainings I had, and basically, the training would cover ethics and boundaries, because it's people working in the communities, and how we collect data safely. That was a big part of that. And then, yeah, how kind of try to discuss together what was the study about, make sure they really understood in their own words, but they really understood what was the core of what we were looking at and how we were going to do it. And they had a few questions that they could use. So they always had kind of a paper support to do that. And when they get lost, they go back. It was one sheet, so literally 4 points, very simple, that they could just use. In terms of the skills that they gained, I think confidence in speaking in public, facilitating, introducing quite a kind of complex terminology to people in the communities, because we're talking about belonging and inclusion and connectiveness to your communities. It's all a bit, again, in their own words, but they did it because that was the main purpose of the study. So I think, yeah, this is what they gained.
Can I just add?
Yeah.
So this is the whole, both questions about skills. So definitely what we're hoping to do is that we don't come in as academic researchers and extract research a bit what you were mentioning about the poverty safari, that we're coming in and doing it, and then doing our ideas and come up with suggestions to how they can live better lives. So what we really want to do is to enable the communities. So provide the skills that we can support the communities, but make sure that the skills stay there when we leave. Yeah. So hopefully the collaboration with the communities between us as academics and the community organizations will continue. And as an example, I've worked with Edible Estates for over 10 years. And there's projects that's planned for the future where we will build on this community researcher approach. So hopefully it will, in time, we will be able to sort of support the communities and upskill people within the communities and make better opportunities, not just for the community organizations, but also for the individual that's working there. That's what we are hoping.
Great, yeah. It sounds like it's benefiting both the academics and the community organization and the community researchers, and that sounds brilliant. Thank you so much.
Okay, we are slightly over 12 o'clock, but we are not rushing. At least I'm not rushing. We have one more question online. So I will give Alex the opportunity before we come to a close. Okay, Alex, please.
Hi, guys. Thanks very much for the talk. I was just wondering about recruitment of the community researchers and sort of like what the general process was for that. If you guys encountered any challenges in doing that, whether there was any resistance, I guess, from people you approached, and also was there any kind of incentivization from their side?
So I guess there's two sides to it. So Anissa is a community researcher, but she's what we call a senior community researcher. So she is not. She has got background and know how to like research and knows about ethics. So there's she can go and do her stuff on her own. Then she has taken on other community researchers that are embedded in the community that she has worked with. And there are other community researchers that I'm working with who has got, like an example is the young male offenders. One of these guys is working as a community researcher, and I don't know how many years of school he has, but it's not as many as he should have. So obviously that process is completely different than when Anissa got the role as senior community researcher. So she applied for the job at the traditional avenues and is employed by Edinburgh Estates, whereas the young guy that works as a community researcher is also employed by the community organization that he's working with, but he was chosen by the members of the community organization, and he's getting a lot more supervision. So it really depends on the community organization and sort of what level of skill we're expecting the community researcher to have. And I know as well that Anissa had some experience with the two people that worked for her. I don't know if you want to.
Yeah, so in our case, one had always been had already been a community researcher for the climate adaptation one, and she was recommended by my colleague. So previous experience in doing facilitation and data collection and all that. And the other person was not hadn't been a community researcher before, but she was very keen, and not everybody was very keen. So those who were, and we thought that they had certain skills and certain ethics, we went ahead with both of them without much fuss, really.
Okay, so I think that.
Cool, thank you.
I think these final two questions, we will bring this webinar to a close. And I want to take the opportunity again to say a big thank you to both Charlotte and Anissa for two great questions. I still have my questions, but I will ask you the questions directly to you some other time. And we will close now this webinar. Thank you for all of you that attended here in the room and online, and hope to see you next time. Bye-bye.